If you had to guess the main cause of work absenteeism over the last 10 years, nobody could really fault you for saying the flu. But did you know that the likelihood of musculoskeletal disorders causing people to miss work has been reported to be over 4 times more? Depending on the job, there are numerous reasons why these problems may come about. Yet, for office workers in particular, it's reasonable to say that poor computer ergonomics is the main culprit. Ergonomics refers to ensuring an ideal fit between a product, the purpose it's used for, and the person using it. So, some examples of optimal computer ergonomics would equate to things like making sure the monitor and chair are at the correct heights for you, and that you're at an appropriate distance from the table and screen. Doing this can help you maintain a neutral body posture, giving you a comfortable working position where your joints are naturally kept at ease and in alignment, minimizing the amount of stress and strain placed on the musculoskeletal system. Yet, if these things aren't in order day to day, then there's a much higher chance of musculoskeletal issues arising. Interestingly though, of all upper body regions, a 2020 study found that the region most affected among office workers in higher education wasn't actually the neck or shoulder, but rather the hands and wrists. But how could bad computer ergonomics possibly bring on pain in the hands and wrists? Let's dive right in, but first, as always, please take note of our disclaimer. One of the two main causes of wrist and hand pain from poor computer ergonomics is nerve entrapment. Carpal tunnel syndrome is the most prevalent nerve entrapment condition of the upper body, estimated to affect between 5,000 and 7,500 per 100,000 office workers. Typically, this condition will arise from the median nerve being squeezed in the carpal tunnel, a 1-inch gap at the wrist, enveloped by the carpal bones on one side and the transverse carpal ligament at the other. The median nerve is important at the hand as it provides the thumb, the index finger, the middle finger, and half of the ring finger with sensory and motor nerves. Yet, it's noteworthy that there are a wide variety of causes for carpal tunnel syndrome, which you can see here. Another upper body nerve entrapment condition you're probably less familiar with that can also arise from poor computer ergonomics is cubital tunnel syndrome. However, a lot less so than carpal tunnel syndrome, so we'll just briefly touch on it. This condition relates to the ulnar nerve that supplies the other half of the ring finger and pinky finger at the hand. Since the ulnar nerve is vulnerable to compression in the cubital tunnel, which is located superficially at the inner elbow, that's how it can come about from poor computer ergonomics. That's because if you place a lot of elbow pressure on the table or armrest constantly, which you'll be more prone to do when not sitting properly, pain can develop locally at the inner elbow, which can then continue to travel down to the wrist and hand via the rest of the ulnar nerve. In contrast, we'll touch on how the median nerve can become compressed in carpal tunnel syndrome from a poor computer setup now in a moment. But first, we need to discuss the second main cause of wrist and hand pain from poor computer ergonomics: tendon issues. Tendons are the terminal ends of muscles that connect them to bone. Numerous tendons around the hand and wrist assist in moving the fingers and wrists in all directions. In fact, just in the carpal tunnel alone, keeping the median nerve company are 9 proceeding from these muscles. Besides these, tendons also run from the forearm to the hand, external to the carpal tunnel in the wrist. Now, usually if our computer ergonomics are how they should be, then the likelihood of running into any tendon problems will be substantially lower than if they weren't. The reason is that our hands and wrists will be inclined to sit at a neutral working position, like seen here, which is when the wrist is straight or only slightly bent, as our bodies have evolved to facilitate this. However, it becomes troublesome when the wrist and hand repeatedly deviate from this position over some time, as shown here, like in the scenario when we have a suboptimal computer setup. That's because if our wrists are stuck at less than ideal angles for extended periods, the tension can become too much and surpass the tendon's load capacity. From this, microtears in the tendon can develop, leading to inflammation, swelling, and pain. This can happen to the tendons in the carpal tunnel, as well as to the tendons external to the carpal tunnel that also cross the wrist joint, like seen in the Quervain's tenosynovitis or with the extensor carpi ulnaris. Accordingly, that's one way how carpal tunnel syndrome arises from poor work ergonomics. First, the wrist gets placed in an abnormal position for a prolonged period. Then, some carpal tunnel tendons start to get micro tears from trying to withstand tension they're not used to for too long. And finally, they swell and expand in size from the consequential inflammation and press upon the neighbouring median nerve. Other ways carpal tunnel syndrome can come about from a bad computer setup is from muscular tightness and joint stiffness in the vicinity, narrowing the gap, or through repeated episodes of tendon inflammation, since that can result in fibrous tissue developing, which takes up excessive carpal tunnel space. On a side note, if you are interested in undertaking our evidence-based and results-backed personalised Plato weight management program, please click the link in the top right-hand corner of the video or follow the link in the description. Moreover, it's important to point out that upper body structural abnormalities stemming from poor computer ergonomics can cause similar wrist and hand sensations seen in carpal tunnel syndrome too, which can lead to the condition being misdiagnosed often. To demonstrate how, we'll discuss a common pattern of muscular imbalances that can arise from shortcomings in computer ergonomics, known as upper cross syndrome. But before we get into that, let's show how many people typically sit at a computer when ergonomics aren't considered. Look familiar? Now let's compare it to how someone sits when ergonomics are taken into account. See the difference? Notice how the shoulders and neck are more protruded, while the mid-back is more extended when we aren't sitting correctly. As you can imagine, if you're stuck in this position for several hours per day for months on end, your muscles will adapt to it. Muscles are elastic, and like anything elastic, an adjustment will be made from forces placed on it. Accordingly, this substandard positioning can make certain muscles tight and overactive, while opposing ones can become weak and underactive. Not just that, but this pattern of imbalance may result in joint dysfunction at the cervical and thoracic regions of the spine, as well as the shoulder too. Judging by the earlier illustration, you can see why it's called upper cross syndrome. Further, these changes can lead to instability around the shoulder region and subsequently difficulty maintaining stability at the elbow and wrist, which can also contribute to pain at the wrist and hand in some cases. Nonetheless, it's notable that not everyone will have the same muscle and joint shortcomings seen in upper cross syndrome from sitting badly at a computer. Since some people may also habitually sit with a bit of a twist, for example, particular muscles can become more susceptible to weakness or tightness on one side of the body than the other. Besides this, don't forget that we all vary in our torso, arm, and hand dimensions, which also influence things. Accordingly, even though upper cross syndrome can give us a general idea of what's happening from a bad sitting posture, it's impossible to have any muscular imbalance pattern which is a one-size-fits-all, so to say. Therefore, we recommend getting a proper evaluation by a physiotherapist for more transparency into what's happening. Anyway, how do these abnormalities in the upper body that poor computer ergonomics can bring about lead to carpal tunnel syndrome being misdiagnosed often? Well, it's because the carpal tunnel isn't the only location where the median nerve can get squeezed. There are at least a half a dozen other locations where it can happen before it arrives at the wrist, that the decreased upper body mobility, strength, and stability that comes with poor computer ergonomics worsens the risk for. And suppose the median nerve becomes compressed at any of these other locations. In that case, it can still lead to referred pain and numbness later down the nerve at the hand, even if the carpal tunnel space was okay, given the misconception of carpal tunnel syndrome. The first site where this can happen is from where the nerves exit from your spinal column, through a small opening between the cervical vertebrae, known as the intervertebral foramen. Nerves can become impinged here when the opening becomes narrowed or tightened. One way that this can happen is from the potential joint dysfunction associated with upper cross syndrome that we touched on earlier. Next, a bit further out from the spinal column, there are 3 more potential compression sites around the neck and upper chest: the interscalene triangle, the costoclavicular space, and the subpectoral space. And then there are 4 other potential compression sites around the elbow. So overall, pain at the wrist and hand from poor office ergonomics and sitting position can be mainly attributed to nerve or tendon problems in most cases. If you'd like to see the guidelines for optimal office ergonomics and the psychological, physiological, vision and biomechanical benefits we can gain from it, be sure to check out our video in the top right-hand corner of the screen. Have you had musculoskeletal problems from sitting badly at the computer? What was your experience? We'd love to hear from you in the comments section down below. Additionally, if you're new here, make sure to like and subscribe to our channel. So that has been our video. Thanks for listening, and I'll see you next time.